The term myopia is very common and people generally think short-sightedness. When the patient is not able to see the distant objects, it is generally termed as myopia or short-sightedness. But it is not a single disease. There are different types of myopia. For example, this anatomical myopia or physiological myopia, then pathological myopia, degenerative myopia, like that. It is of different types of disease are there. Among these varieties, one term, that degenerative myopia, is to be considerable, because in this particular condition there will be some degenerative changes in the eye. These degenerative changes are mainly in the retina, and we know retina is the most important part of the eyeball. It is the posterior most layer of the eye, which is rich with the nerve endings. And here there is a particular point, macula, where the light rays are converged, and only after converging these light rays, these different changes or reactions are happening, and as a result this an impulse is developed. This impulse is carried to the brain, and this impulse is converted or changed to actual visual sense. So it is very important that if there is any changes or any defects in the retina, vision is not possible. Correct, perfect vision is not possible. So in the case of degenerative myopia, if there is a degenerative change or a pathological change in the retina, even though the refraction is corrected, vision will not be corrected. That is the point to be noticed. So in such a condition, the first step of the treatment should be to rule out if there is any such changes and to control and find remedies to solve this problem first. Then the remaining part, that is the refractive changes, refractive defects, can be controlled either by medicines or treatments or exercise and these glasses, contact lenses, so many things are there. But none of them will control degenerative change. For that, treatment is necessary, medication is necessary, and for this purpose there are so many methods, so many medicines, treatment procedures, and procedures means not only ophthalmic, extra ophthalmic procedures are there. Like, because we know this main area where the sense is developed is in the head brain only. So we have to do the treatments on the head also. Like in Ayurveda there are Shiro Abhyanga, Shiro Dhara, Shiro Vasti. These are some among them. The procedures are still there. So from these procedures we have to select which is suitable for that particular patient. Whether he is a small kid or a teenage or youth, like that, the age also is a factor in selecting the medicine and also selecting the treatment procedure, because there is a pattern for the development of disease and also for the development of the person. So up to 20 years we have to consider as a growing stage. From 5 to 20, the person will be, or child will be in a sharp growing stage, and the disease also, if there is an anatomical change in the eye, this change also will be growing fast according to the development of the body. For example, the main factor, the anteroposterior diameter of the eyeball, that means from the posterior end to the anterior-most point. That distance or diameter will be directly proportional to the height of the child during growing stage. So when there is an increase in the height, there will be possibility of increasing in the anteroposterior diameter of the eyeball. This will reflect as increasing the myopia. So we have to change the glass repeatedly to make it more divergent. So beyond this, if there is a degenerative change in the retina, everything is again serious. We have to solve that problem first. So a treatment is necessary to control the degenerative myopia, and it is possible by Ayurvedic methods. That is sure, there is a hope in Ayurveda to control degenerative myopia.